Blood supply of the heart. Heart is supplied by the right and left coronary artery. This is right coronary artery. This is left coronary artery. Right coronary artery is arises from the ascending aorta. Ascending aorta contains three aortic sinus, anterior aortic sinus, posterior left and posterior right aortic sinus, not seen in this model. So, the right coronary artery arises from the anterior aortic sinus, a elevated area on the ascending aorta. Then it runs in between right auricle and pulmonary trunk, and it descends through the anterior part of the atrioventricular group, and it gave its first branch, the right conus artery, for infundibulum of the right ventricle. In 60% case, it supply a artery for AC node, which is situated just below the opening of the superior vena cava. When it descends through the anterior part of the atrioventricular group, it gives another branch. This is atrial branch, supply the right atrium. These are the anterior ventricular branch, supply anterior surface of the right ventricle. This is right border, this is inferior border. At the junction of right border and inferior border, it crosses this border and go posteriorly, and along the posterior part of the atrioventricular group it runs, and near the posterior interventricular group it give a terminal branch. Name of the terminal branch is posterior interventricular branch of right coronary artery. This is posterior ventricular branch, supply the posterior portion of the right ventricle. This is another branch. It's anastomosis with the circumflex branch of the left coronary artery. So the posterior interventricular branch of the right coronary artery supply right part of the right ventricle, part of the left ventricle, and there is a inner structure present. This is the interventricular supply, interventricular septum, and this interventricular septum is supplied by the posterior interventricular branch of the right coronary artery. Only the posterior 1/3 of the interventricular septa is supplied by this artery. This is the trunk of the left coronary artery. At the beginning, it gives two large branches. One is anterior interventricular branch of the left coronary artery, which runs through the anterior interventricular group. It supplies the anterior 2/3 of the interventricular septa and anterior portion of the right ventricle, anterior surface of the left ventricle. This is diagonal branch which arises from the main trunk of the left coronary artery. This is circumflex branch, is passed through the left border of the heart and run through the posterior part of the atrioventricular group, and it anastomosis with the its end by anastomosis with the branch of the right coronary artery. When the posterior interventricular group contains posterior interventricular branch from the right coronary artery, this pattern of blood supply is known as the right coronary dominance. And when sometime the right coronary artery is end here and circumflex branch is more developed and it end in the posterior interventricular group as posterior interventricular branch of circumflex artery. So the right dominance is better than the left dominant because here you see the right coronary artery supply right atrium, part of the right ventricle, most of the part of the right ventricle, except near the anterior interventricular group, which is supplied by the anterior interventricular branch of the left coronary artery. So right coronary artery supply this portion of the right ventricle, posterior part of the right ventricle, and it also supply the posterior 1/3 of the interventricular septa. If the right coronary artery end here and circumflex is developed or run along the posterior interventricular group, what happen? It supply, the left coronary artery supply part of the right ventricle, most of the whole blood supply of the whole left ventricle when it supplied by the circumflex branch of the left coronary artery, and this circumflex branch end as posterior interventricular branch of the circumflex artery. So in left dominant, if left coronary artery block here, what happen? The anterior 2/3 of the interventricular septa don't get blood supply. Portion of the right ventricle don't get blood supply. Whole left ventricle don't get blood supply. The posterior interventricular branch of the circumflex artery supply posterior 1/3 of the interventricular supply. So this supply also loss. So what happened? The total blood supply loss of the interventricular septa, loss of blood supply of whole left ventricle and part of the right ventricle. So left dominance is less better than the right dominance. If block is occur here, then the portion of the anterior 2/3 of the interventricular septa don't get blood supply, but rest of the left ventricle and posterior 1/3 of the interventricular septa get blood supply. In the right dominance, what happen if the left coronary artery is blocked? The right coronary artery supply posterior 1/3 of the interventricular septa, part of the left ventricle, part of the most of the part of the right ventricle is supplied by the right coronary artery. So total loss of left ventricular supply and interventricular septum blood loss is not occur. So this is all about the blood supply of the coronary artery. Thank you for watching.